Let's talk norovirus. It's really hot in the news right now. We're actually seeing higher levels than we've seen since the year 2012. What is norovirus? It's a nasty stomach bug that causes your typical stomach bug symptoms. Nausea, vomiting, diarrhea, fever, headache in some people, just makes you feel miserable. Incubation period is usually 24 to 48 hours, can be a little shorter or a little longer. The good news about norovirus is that it is self-limited, meaning that in most people, it's just going to run its course and then go away. Usually it lasts 2 to 3 days. The big kicker with norovirus is that people will still be shedding virus and contagious a couple of days after they're feeling better. So after you've had this, be careful when you go back to work because you still could potentially spread this virus around. Some studies show that people will continue to shed virus for up to several weeks after they've been infected. People who are at higher risk of serious illness from norovirus are the usual suspects: very young, infants, people who are older and have underlying immune system problems or chronic health conditions, people who live in inpatient facilities. This tends to spread like wildfire there. We also see it a lot on cruise ships. Norovirus is super contagious. It's spread person to person. Often a person will catch it from fresh fruits or vegetables, especially green leafy vegetables, or ready to eat fruit like that's prepackaged. It only takes a few particles of the virus to become infected. The virus can live on surfaces for weeks in some cases. So you have to be very vigilant about washing the surfaces after you've used any of these things on it, or if there's somebody in the house who has norovirus, make sure they're not handling any of the food. Also, this can infect food that's been cooked. If someone who has norovirus handles it after the cooking, it's very resistant to hand sanitizer and several different kinds of cleaners. So the best protection you have is obviously stay away from the sick person and don't have them handling your food. But hand washing is the best way to kill it with soap and water. We think about hand sanitizer and Lysol, but that's probably not enough in this case. There is no vaccine currently to help prevent norovirus infection, but there is at least one that I know of that is being tested to see if it may be available for use in the future. If you run high fevers or if you have diarrhea or vomiting for several days in a row to the point that you feel dehydrated, if you haven't made any urine in 8 to 12 hours, if you're unable to keep any fluids down, you may need fluids. You may need IV medications or other things to help control the symptoms. So most people get better. If you're one of the small percentage of people who don't hesitate to seek medical treatment if you need it. Bottom line, norovirus, bad. Hand washing, good. Stay healthy this year, people.